Gaza faces a critical health challenge. Polio has re-emerged. To combat the outbreak, a large-scale vaccination campaign is underway in southern Gaza. The goal is ambitious: vaccinate 340,000 children against polio in just 4 days. The first day of the campaign saw remarkable success. Over 161,000 children received the polio vaccine. This brings the total number of children vaccinated since September 1st to 355,000. The campaign relies on the dedication of healthcare workers and volunteers. Over 500 vaccination teams have been deployed across southern Gaza. This includes 380 mobile teams, ensuring that even hard-to-reach communities are included. The initial phase, targeting central Gaza, has already proven successful. More than 187,000 children in central Gaza received the vaccine in the first phase. Vaccinations were provided at various locations. These included health centers, schools, and mobile clinics. 4 major health facilities in central Gaza continue to offer vaccinations.
Despite the progress, challenges persist. The ongoing conflict has severely impacted Gaza's healthcare system. Medical evacuations have been suspended, leaving thousands in need of urgent care. An estimated 12,000 patients are now stranded. They are unable to access specialized treatment outside of Gaza. The situation is particularly dire for those with chronic illnesses and those requiring complex surgeries. Access to basic necessities is also limited. Clean water and sanitation facilities are scarce. Hygiene items are expensive and often unavailable. This creates a breeding ground for diseases like polio. The conflict further hinders humanitarian efforts. Movement restrictions and security concerns create logistical nightmares for aid organizations. Delivering aid to those who need it most becomes a complex operation.
The recent escalation of violence has exacerbated the already dire humanitarian situation in Gaza. Airstrikes and ground operations have resulted in civilian casualties and widespread damage. The destruction of infrastructure, including homes, hospitals, and water treatment plants, has further crippled Gaza's ability to cope. The displacement of families adds another layer to the crisis. Thousands of people have been forced to flee their homes. They seek refuge in overcrowded shelters. These shelters often lack basic amenities, putting people at further risk of disease. The conflict has also taken a toll on the mental health of Gaza's residents. Constant fear, uncertainty, and trauma have left many, especially children, deeply scarred.
Despite the challenging circumstances, humanitarian organizations are working tirelessly to provide aid and support to those affected by the conflict. The World Health Organization and UNICEF are leading the polio vaccination campaign. They are also providing essential medical supplies, clean water, and sanitation facilities. Other aid organizations are distributing food, hygiene kits, and other essential items to displaced families. However, the ongoing violence and restrictions on movement continue to hamper these efforts. Access to certain areas remains limited, and aid workers face security risks. The international community must pressure all parties to the conflict to allow unimpeded humanitarian access. Without it, the humanitarian crisis will continue to worsen.
The international community must act decisively to address the deepening humanitarian crisis in Gaza and the West Bank. The top priority should be ensuring rapid and unimpeded humanitarian access. The United Nations Office for the Coordination of Humanitarian Affairs should coordinate the delivery of aid and ensure that it reaches those most in need. This includes facilitating the movement of medical supplies, personnel, and essential goods. A ceasefire is crucial to allow humanitarian organizations to operate safely and effectively. All parties to the conflict must respect international humanitarian law and ensure the protection of civilians. Long-term solutions require addressing the root causes of the conflict. This includes working towards a just and lasting peace that guarantees the human rights and dignity of all.